Assalamu alaikum dear doctors. In this video I am discussing about the facial palsy from NICE guideline. So first the recognition and assessment. Definition. Bell's palsy, that is an idiopathic lower motor neuron facial nerve palsy. Exclude the secondary causes of facial nerve palsy due to infection, inflammation, tumor, trauma or vascular event clinically and or with appropriate investigations. Now symptoms and signs of the facial palsy. First, there is asymmetry of the face or smile and loss of nasolabial fold on same side. Demonstrate weakness in the lower motor neurons distribution includes the loss of wrinkles on the forehead. Remember one thing, loss of wrinkles of the forehead occur in lower motor neuron lesion. Upper spare upper. In upper part of the motor neuron lesion, we find that upper part working. Now, increase or decrease lacrimation, hyperacusis. What is hyperacusis? That is, they hear the sound excessive amount, high sound. Altered state, facial pain and difficulty in closing eyes. Now, history. History is that what history we take in facial palsy, that is history of any prior viral infection may be present, abrupt onset with no progression, no history of preceding seizure or head injury. Examination we do for facial palsy is that full neurological examination including the other cranial nerves and fundoscopy, ear, nose and throat to exclude the cholesteatoma, mastoiditis or herpes infection, blood pressure to exclude the hypertension, check for lymphadenopathy, hepatosplenomegaly, pallor or bruising to exclude the malignancy. Now the investigations we do for facial palsy, if all history or examination unremarkable and no other neurological sign and symptoms, no other investigations is needed. But if difficulty in closing eye, ophthalmology referral. Bilateral facial palsy that consider Lyme disease, Guillain-Barré syndrome, brainstem pathology, discuss the further investigation with consultant with special interest in neurology or tertiary pediatric neurologist. Recurrent facial palsy, discuss with the senior. Recurrent infections, first-line immunodeficiency investigation including HIV. Severe pain associated with varicella zoster. Now the treatment of facial palsy. Immediate treatment is that if difficulty in closing eye, provide the eye patch and carbomer ointment. If vesicles suggest, that is herpes simplex virus, then we prescribe acyclovir oral. Within 72 hours, prednisolone 1 mg per kg per day, maximum is 60 mg for 5 to 7 days can be given as per adult practice, discuss with the senior. Now the discharge and follow-up of the facial nerve palsy. 4 weekly GP follow-up until symptoms and signs resolved 95% by 1 year. If facial palsy does not improve considerably within 4 weeks, arrange cranial imaging MRI brain with request to focus on brainstem. If any other neurological sign or symptoms, consider early or immediate imaging. So when the indication of MRI brain in facial nerve palsy, that is, if facial palsy does not improve considerably within 4 weeks or 1 month, then we do the MRI. So this is all about the facial palsy according to NICE guideline. Thank you very much.